Guys, today I'm going to talk about what a patient with an orthopedic infection who hasn't had surgery loses in his life. You who are a patient there know how much you've already lost, right? But I think it's worth telling everyone here. My name is Mário Soares. I'm an orthopedic surgeon specializing in orthopedic infection. Think about it. You're there, full of pain, with deformities. You have a wound that oozes pus all the time. What are you not doing? Remembering that you've often lost your independence. You depend on your wife, your husband, your friends, your children to help you. You can no longer lead an independent life. That's very bad, people. It's terrible. You want to go to a party, you have a wound with pus coming out of it, you want to have sex with your partner, you can't. This all has a negative impact on you. All this has a negative impact on your life. You stop working. Most of my patients don't work. Those who are self-employed tend to work there as best they can to support themselves in a situation like this with pain all day long, because the pain of infection is constant, daily, there's no timetable. At night, the patient wakes up in a lot of pain. They take a lot of medication. They start taking a lot of antibiotics. They start having kidney changes, liver changes. They get nauseous. The patient is full of problems from the disease and the treatment of the disease, inadequate treatment of the disease. So understand, it's a shame to have a problem like this, but know that there is a solution. There must be a solution, and it involves some kind of surgery. It's of the utmost importance that you who have this problem go for a consultation to be able to understand that the doctor understands that it's me, but that we understand your case, and give you the best solution and implement that solution as soon as possible. Because, in short, what do we want here? To rid you of this problem and restore your quality of life. You need to resume your life. You need to resume your work. You need to resume your love relationships, your relationship with your family, your relationship with society. Most of my patients end up staying at home, locked up. They isolate themselves. They're cut off from society. They don't take part in the life of society, the life of the family, even the life of their partner. Sometimes they feel like a problem for the people around them, a burden. People have to carry him. This feeling, I've already talked about the loss of independence in the video here. This is what bothers people the most. They depend on other people to do things that they clearly feel they can handle. This has to stop. And it goes through surgery. So seriously, go for it. Try to find out the extent of their problem and the solution. Not infrequently, incredible as it may seem, not infrequently, many of my patients who put it off, live with this suffering, sometimes have solutions that aren't so complicated. We always talk about very complicated situations here, but I have many patients who, no kidding, even simple surgeries, manage to solve the problem and get the person's life back on track. And even if it's a complex situation, we manage to resolve it. But you have to take that first step. And I can assure you, the vast majority of patients, practically all of them, once they've had the right treatment, they regain at least their independence, stop feeling pain, and resume their social and family life. So that's what I want to leave you with here. Remember that we also talked about behavioral orthopedics. It exists precisely for this reason, because we begin to see that these patients, and this I say is a flaw perhaps of modern medicine, we start to see the patient, only the problem, we forget about the whole. And here's the thing, I can't solve one thing or another separately. So our approach is broad, it's interdisciplinary, precisely because of this. Why is that? I'm not just treating your knee, your hip, your leg, I'm treating you, and I want you to get your life back on track. There's something I always say to my patients. I always come up with something based on their profile to say, when you get well, we're going to do something specific like this. So I've been to the mall with the patient for a walk around the mall, because the patient's dream was to go for a walk in the mall after she got well. So I said, well, now you're well, you're cured, you're great, you've done your rehabilitation, let's go for a walk in the mall. And then we went there and had a coffee at the end, so that's it. That's what we're talking about here. It's about getting your life back, having a full life, a life without pain, a life without infection. It's horrible. Imagine a wound, smelly, oozing pus. You can't live with that. That's what we want to end here. Is that right? There is life after this problem. You have to believe in it because you'll make it. The philosopher Seneca says that part of healing is the desire to be healed, and that's a motto I have every day I leave my house. And I have to instill this in you. You have to have the desire to be healed. That's the moment we operate and get well. That's the patient who succeeds. Is that right? A big hug to you. I'm very happy to make these videos here where we talk about things other than just the technique. That's actually what I like best. Cheers. Don't forget to like and share this video with those you love so much. Cheers.